There are three natural keys to autoimmune disease. And if you understand these three natural keys, you have been given huge control over whether you have this autoimmune condition or don't have it. In other words, you stack the odds heavily in favor of not having these autoimmune conditions. Now, the only difficulty here is some autoimmune diseases involve damage to an organ, like type 1 diabetes in kids. There's irreversible damage to the beta cells of the pancreas, and that can't be restored. Or if you have Hashimoto's thyroiditis and it's present for more than a few weeks, you can irreversibly damage your thyroid. If you have autoimmune hepatitis, you can do irreversible damage to your liver. So the key is to know about these three natural strategies and do them as soon as possible in life before you incur any kind of damage. In some cases of autoimmune conditions like rheumatoid arthritis, there is indeed time to reverse it and you may be left with no damage. But key is do this as early in life as possible. The first strategy is to avoid all sources of the gliadin protein. The gliadin protein comes from anything made with wheat, but also related grains like rye, the secalin protein of rye, the hordein protein of barley, and the zein protein of corn. We know with good science that those proteins, those grains, initiate an increase in intestinal permeability. And you can actually measure that. There's a test for a protein called zonulin protein. The higher levels of zonulin you have, the higher the greater the degree of intestinal permeability. And so when intestinal permeability is increased, bacterial breakdown products of food, and even gliadin itself can get access into the bloodstream and lymph and activate the immune response. Now, there's a whole variety of immune response that can be activated. It could be against the joints. That would be rheumatoid arthritis. It could be against the thyroid. That would be Hashimoto's thyroiditis. So there's a whole variety of autoimmune conditions that are activated by this process, initiated by the gliadin protein of wheat. Well, how do you get rid of the gliadin protein of wheat and related grains? Don't eat grains, right? Especially wheat, rye, barley, and corn, the four most offensive when it comes to initiating the process of autoimmunity. Number two, we address vitamin D in my programs, in the Wheat Belly and Undoctored programs. And we get vitamin D at a dose sufficient to raise your 25-hydroxy vitamin D blood level to the range of 60 to 70 nanograms per milliliter. Typically 6,000 units. We only use oil-based gel caps because tablets are very poorly or erratically absorbed. Drops are very inconsistent in delivery of a vitamin D dose. So we only use oil-based gel caps. They're inexpensive and very reliable. You do want to get a blood test eventually. Don't get the blood test any sooner than 3 months after initiating your vitamin D or changing the dose, because it takes about 3 months for so-called steady state to be reached. That is, for the level to level off. Three is the most complex one. And that is to eradicate small intestinal bacterial overgrowth. SIBO, we say. What is SIBO? SIBO is a situation, a peculiar situation, that, by the way, is at epidemic levels. It is far, far more common than I ever thought. There's a device you can now buy, it's called AIRE, A-I-R-E, that detects breath hydrogen gas that bacteria produce. Humans don't produce much hydrogen gas, but bacteria produce plenty of it. And you can assess that by using this device. And when we look for it, we're finding it everywhere. So SIBO is a situation in which unhealthy bacterial species, such as E. coli, Campylobacter, Citrobacter, Shigella, that are supposed to be in the colon, proliferate. They increase in number dramatically and then ascend up into the upper intestine, the ileum, the jejunum, the duodenum, the stomach. And so you, in effect, have 30 feet of bacterial infection. But there's more to SIBO. There's also an increase in intestinal permeability, just kind of like what the gliadin protein does. Once again, you can detect higher levels of zonulin as an index of intestinal permeability. You could also detect higher levels of lipopolysaccharide. That's a breakdown product of these bacteria. When those bacteria of SIBO die, they release lipopolysaccharide and other things into the intestines, which in turn gain access into the bloodstream, and you have as much as a 400% increase in levels of this lipopolysaccharide. Well, lipopolysaccharide is a hugely inflammatory molecule. Just a teensy-weensy bit injected into a mouse can kill it within minutes. So we have a flood of lipopolysaccharide, which causes body-wide inflammation, activates and turns on autoimmunity and worsens the inflammation. So identifying whether you have SIBO and then managing it is very, very important. Now, that's a more complex topic. If you think you have SIBO, take a look at one of my videos on YouTube or look at my Wheat Belly blog. I have videos called The Telltale Signs of SIBO. Look for signs that you might have it, such things as seeing fat droplets in the toilet or fat staining where the water meets the porcelain. Or if you have fibromyalgia, that's virtually synonymous with SIBO. Restless leg syndrome, very high likelihood of SIBO. If you are overweight, obese, or have type 2 diabetes, there's at least a 50% chance you have SIBO. If you have an autoimmune condition, very high likelihood you have SIBO. If you have irritable bowel syndrome, there's a very good chance you have SIBO, maybe as high as 85% likelihood. Some people are debating whether we should do away with the irritable bowel syndrome label and just call it SIBO. In other words, SIBO is everywhere, and it amplifies body-wide inflammation, and it can be one of the factors that allows you to have an autoimmune condition, or it makes your autoimmune condition worse, especially ulcerative colitis and Crohn's. It makes those diseases much worse. So part of addressing those conditions is to address the SIBO. Now, you can get the AIR device. If you want to know how to use it, don't follow the instructions that are provided, because the inventors did not know this was a device for SIBO. They thought it was for something else. So you'll have to go to my Wheat Belly blog or my Undoctored Inner Circle to show you how to use the thing. We use a prebiotic fiber challenge and then measure hydrogen gas over the next up to 3 hours to see if you have a positive response. If you do, then it's time to correct the SIBO. And for that's a more complicated conversation. I do invite you to join my conversation in my Undoctored Inner Circle membership website, where we talk about how to increase the efficacy of antibiotics. We use herbal antibiotics with proven efficacy. How to stack the odds of a positive response by using such things as biofilm disruptors and prebiotic fibers during the antibiotics. And I show you how to prevent recurrences, which are very common in SIBO eradication. So that's in the Undoctored Inner Circle. But know that those three things, elimination of wheat and related grains, restoration of vitamin D, and eradication of SIBO and the metabolic endotoxemia that accompanies it, are three extraordinarily powerful strategies. These are things your doctor should have done, but they're not, because they practice, like I told you, willful ignorance. And you know what? These things don't make anybody any money, right? There's no thousands of dollars per month biological agent that comes from this. We're talking about vitamin D that costs you maybe $2 a month, a change in diet that should cost virtually nothing, and then some efforts at SIBO. There may be a few dollars here and there for such things as an herbal antibiotic, but we're not talking about very much money at all. And know that, put those three things together, you get a powerful synergy and stack the odds heavily in favor of pushing an autoimmune condition into remission.